Isn't it time you stepped up and took control of your health? This is Dr. Tom Roselle. Join me on September 17th at the Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that will change your health forever. Special guest Ann Abernathy, known as Grandma Luge, a 6-time Olympic athlete and oldest ever to compete, will be there to motivate you and show you how to take control of your life and put your health in your hands. Don't wait. Register today at rosellecare.com or call 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio. Give me a call, 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem and you've done the same old. You've applied, you've tried, you've looked, you searched, and come up with absolutely nothing. Well, this is your opportunity. This is where you can put the fix in and get it done without drugs, without surgery. Ask the questions that you want, whether they're controversial or otherwise. Let's talk about them. 888-630-WMAL. Call me now and let's discuss your problems. I have a special guest in the office, someone who is one of our colleagues in our practice, Dr. Stephanie Pina, and we're going to be talking about a very controversial but interesting subject, something that works extremely well. We're going to be talking about acupuncture, but we're going to be talking about it in a very specific venue. We're going to talk about acupuncture relative to weight loss, and the studies are out there, and acupuncture works. It makes a difference. It's huge. You can't ignore results. I've been practicing acupuncture as well as chiropractic for 35 years, and Dr. Pina is, as well as Connie Kern, is part of our acupuncture department, and they have some amazing stories, and they have things that have been done that sometimes defies imagination. But when you think about stimulating these points, these hundreds of points that are all over the body, and the end result is that you end up losing weight where perhaps you couldn't have gotten it done before, that it starts coming off. And the studies out there going back to even 10 years ago, 20 years ago, we're going to talk about a few of them, even 3 years ago in Dr. Oz's program. Anyway, I'd like to introduce Dr. Pina. Good afternoon.
Good afternoon. Thank you for having me.
It's always delightful to have you on. It's fun because it's an area that I have tremendous interest in, one that has always been part of our treatment approach for many years. And this is an area that is a challenge, meaning weight loss. I mean, we live in a society today where so many people are unfortunately overweight. And they've done diets, and they've lost the weight, and they put it back on again, or they can't lose the weight, and it just sits there and says, I've really tried. Well, acupuncture is a tool that we can incorporate that can make a huge difference. Dr. Pina, tell us a little bit about acupuncture relative to weight loss. And we talked about acupuncture energy called Qi and so forth, but this is a fascinating area. How does it work?
Well, essentially what the acupuncture is doing, and when you use acupuncture points, is that it's helping to stimulate the body to basically put itself back into balance, and this is called homeostasis. And when it comes to weight loss itself, what it's doing is to help to improve blood flow basically to those digestive organs that essentially are moving the foods that we eat around, helping digest them better, help them basically delay the response of food in the stomach, so essentially you have a little bit of a decreased appetite. And then it also helps in other ways, that essentially, if it's the emotional component that drives us to eat or not want to exercise, or if there's a metabolic component that essentially there's other diseases and stuff that's going on, it's going to help put the body back into balance the proper way so that you can achieve the results that you want.
Well, everybody's talking about acupuncture today. They're talking about how it works, what it's good for, and in combination with all those things that are in the natural world. But, when we take a look at the benefits, we try to pin it down. Acupuncture for weight loss or weight control is based on the premise that weight gain can be the result of disturbed energy, correct? And, it also is a disturbed energy in the brain, and it has, the brain has a mechanism. It's called the hypothalamus gland. The hypothalamus is that center that controls your desire to eat and to stuff. It also tells you when you've had too much. And it tries to maintain a balance. We call it homeostasis, and it allows the body to run like a finely tuned machine. But unfortunately, things get out of whack, and our normal rhythms that control thirst and hunger and body temperature and other feel-good chemicals no longer are in balance. But acupuncture can change that, correct?
That's right. It's one of the easiest ways that they've been, one of best ways they've been actually seeing through research is basically they're trying to figure out what is the direct way that acupuncture works. And really by looking at neurotransmitters that come out of the brain, how it affects other organs in the body, essentially they're kind of seeing that there's a direct result where different chemicals are turned on and off that help stimulate the body and help with digestion.
Well, a lot of people think that, when we're dealing with acupuncture, when we're dealing with these chemistries, that we're targeting one specific area of the body. We're targeting the feel-good centers of the brain. But what they don't realize, and what most people don't get, is that to have an effect, for example, if you have to treat the production of serotonin, you're not going to treat the brain. You're going to move the serotonin in the brain, but the serotonin is actually produced in the intestinal tract.
Correct. Yes, actually, when they measure serotonin levels, they actually see that there's two separate amounts of it. The one that we think about that's in the brain that we might think of affecting moods and disorders, and then there's actually the intestinal tract actually produces its own version of serotonin as well too, so it's going to affect everything directly.
Actually, about 80% of that feel-good juice is produced in the intestinal tract. So when you have a gut that's not working, we call it permeable sometimes, where the intestinal lining becomes thick and fissured and so forth, it doesn't have the opportunity to absorb things properly after they've been broken down, and we end up with inflammatory pathway problems. And excess of weight, fat, if you will, is the body's own defense to protect us from acid and inflammation. It locks it in. So when we have too much acid and we have too much inflammation in the system, we get too fat. So with acupuncture, let's talk about the basics of this thing. Is it a fad, or is it something that's, really works and has been around for a long time? Underlying question.
Well, basically, most of the studies have been out since the 70s. When you look at traditional Chinese medicine journals and textbooks and stuff, 3,000 years ago when this all began, they weren't exactly worried about losing weight. If anything, they were worried about keeping it on and maintaining their health because they had to deal with disease and famine. So a lot of the research that's come out lately, and when people have used it in their clinics, is essentially based off of observation. And in the 70s, they started to do research. They wanted to see how it worked and how effective it was going to be as far as how many times people had to come into the office and get treated with acupuncture points, if there were certain ones that worked better than others. But they noticed that people would come back in and say that at least they felt better overall, and they felt like they could make their goals better by using the acupuncture points as well as seeing changes in their weight loss numbers.
There's actually hunger points that are used, right, specifically to control the desire to eat.
There are. Very effective points are actually used in the ear, and there's actually hunger and thirst points. There's points that address the adrenals, which again go back to that hypothalamus reaction, so you're actually stimulating the brain and actually improving cortisol levels. And essentially there's points for all the different organ systems in the body. So using things like the liver and the stomach are actually going to help promote blood flow to those areas so that we can digest, process foods better, and then actually process toxins and get those out, which may be causing some of that weight loss, weight gain as well.
There's a term I like to use in acupuncture in describing how the body calms itself, and it's called Shenmen points. I like that word. It just kind of flows, Shenmen. But what are Shenmen points? And they're really important in weight loss.
Shenmen points are basically like those homeostatic points. When you put it in, if there's an overactive system, it kind of calms it down. If there's a system that's not functioning properly and it's underactive, it's going to speed it up. So essentially, if the body's maintaining weight and can't get rid of it because there's things that are slowing down too much, you can use these points basically to help speed it up. They're also really good when it comes to the emotional side of it too, because it can help with balance emotions. So a lot of the times when we think of the emotions and, thinking of the heart itself, there's heart points on the Shenmen, they're called Shenmen on the heart meridian, that essentially help with the emotional side. So you want to look at a number of different aspects, and that's why when it comes to acupuncture, you use a number of different points that you normally wouldn't think of.
So it's not just identifying 1 or 2 or 3 points, although there was a program that was on, I think it was Dr. Oz 4 years ago, and they were talking about weight loss and acupuncture, and they brought out several interesting facts. One was that acupuncture, in a sham study, they did acupuncture for weight loss, and they did a study that they didn't do anything. And the acupuncture patients, just receiving acupuncture, lost 3 times as much weight as the patients who didn't employ the acupuncture. But also, what they were talking about is that there's these 4 points, these 4 magical points, and the underlying situation is that's not really true. There's more than 4 points, and they're body points, and you're facilitating more than just the dampening of the hunger centers to control weight loss.
That's absolutely correct. Because if you think about it, we all gain weight for different reasons. And then people, when they lose weight, one thing works for one person, the next thing works for another. So you can use certain points that are used over and over again, that are popular, that you know have a stimulating effect on, say, digestion or on mood control or the way that the brain is releasing certain chemicals to help out with weight loss. But you still have to sit down with each individual and figure out why they haven't been able to lose their weight to begin with. And essentially what they've done in the past and where are they right now. Why aren't they losing? And then you can choose acupuncture points that are specific for them individually.
So here's what you get to do. This coming Wednesday evening, Dr. Pina will be your host at our in-house continuing education program. So if you'd like to find out how acupuncture can really work and help you with the few extra pounds that you'd like to take off, this is an opportunity to really find out how the pieces of the puzzles come together, because the weight that you have is really taking years off your life, and if you want to make a difference, you want to change a few things, or if you just want to look a little bit better because your clothes aren't fitting well, this might be the key to bring everything back together in the right way. Give our office a call at 703-698-7117. That's 703-698-7117, and tell my staff that you'd like to attend Dr. Pina's presentation this Wednesday evening, August the 10th at 7:30 p.m. Please be our guest, but remember, as always, we need a reservation because we have limited space, and once those chairs are filled up, it's all done. So 703-698-7117. This Wednesday, August the 10th at 7:30 p.m., Dr. Pina will be speaking to you on acupuncture and weight loss, and she'll answer your questions on a one-to-one basis and tell you what's really possible, what can be done, what can't be done. But it's really a presentation that you want to be at if you are serious and need a little help, need a little extra way of taking it to the next level. You know, when we're dealing with acupuncture and weight loss, there's the studies out there say somewhere between 10 to 15 treatments, and you start seeing significant results. Is this a protracted situation, or is it something that people can get a benefit from, relatively short, straight up if they do what you tell them to do?
Well, it's a mixture of both. You can start seeing results pretty quickly, especially if there's other ways we're gaining weight, like especially with water retention. If you start making changes in the way that the body retains water and decreasing inflammation foods, things that might be aggravating the body to actually maintain weight, that's going to be one way kind of seeing some quick weight changes right away. But you do want to kind of make sure that just like you're eating every single day, you want to do something proactive for essentially treating your weight loss every single day as well. So continuing on a program, usually anywhere between 10 to 12 is what they've been seeing in the studies as far as treatment numbers. But essentially the more times people come in and get it, and the more they can be proactive about using those acupuncture points and stimulating points, the better. One
of the first studies that came out about 13 years ago at the University of Adelaide in Adelaide in Australia, and it was 1998, and what they did is they had all the people undergo just electrical stimulation of the acupuncture points for appetite suppression, and what they found was in the study that 95% of the people that participated, and it was a substantially large group, they showed the results that acupuncture did in fact reduce their cravings, it reduced their need and want, and increase their satiation when it came back to food, and their weight just came down without changing the types of foods they ate, but the quantities of foods, because sometimes we don't realize how much we actually are eating, and we're grazing all the time, but instead of going to grab something that we shouldn't be grabbing for whatever reason, acupuncture can make a huge difference in controlling that desire.
Yeah, absolutely. You don't always have to be concerned about the weight loss, but essentially you do want to be concerned about different things that are going to affect your overall weight program.
We're here at 888-630-9625. That's 888-630-WMAL.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. We're talking about weight loss and acupuncture, something that can actually help you take that next step. My guest, Dr. Stephanie Pina, and will be your host this Wednesday evening at the Roselle Center for Healing. And if you'd like to listen to about what really can take place with a little extra help with weight loss, this is your opportunity. Give my office a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Pina's class this Wednesday evening, the 10th of the month at 7:30 p.m. Love to have you as our guest. Love to help you in any possible way that we can possibly help you. Let's go to the phones. Marie, thank you for waiting. How can I help you? Marie? Hello?
Roselle, this doesn't pertain to the weight today. I was trying to call early so I could get you the question before we got on the air. But what it is about, Dr. Roselle, every morning when I get up and look in the mirror, it's kind of like a person that frowns. I have these marks on my lips, like I've had my lips poked out, either like for sucking or whatever. But how can I make myself not go to that?
Okay, so let's talk about what controls the musculature of the lips. There's a muscle that goes around. It's called the orbicularis oris, and that just means a round muscle around the lip, and that gives us its tone. But that muscle and also the facial muscle expression are controlled by nerves that come from the brainstem and also from the neck itself. So if there's any compression, any irritation to those areas, those muscles are going to not have the tone that they should have, and it's going to look like the facial muscles have let go and the lips will come out. And to reverse that, you have to find the nerve roots that are irritated and take the pressure off them. Also, interestingly, acupuncture has, and you're right on topic with this, acupuncture has many points on the face. Around that area, you have the end point for the large intestine acupuncture channel. You have other points that service that area, and we do a lot of work in the office on facial cosmetic acupuncture, or what's called constitutional facial acupuncture, because we use all the points in the body. But when we think about the points ending in many different areas, there's a huge amount of points, acupuncture points, that end or start on the face. And when these areas become stagnant or they in some way get blocked up so they can't move, the energetics are not moving, it's going to affect the muscle tone, it's going to affect the way the face looks, it's going to allow the face to sag, it's going to allow these muscles not to work. So you have to look at the neurology, and you can also need to look at the acupuncture system.
Yeah, using the acupuncture points actually locally, you can essentially improve blood flow back to that area. So just like where you're trying to tone any other muscle in the body, you want blood flow and oxygen flow to go in there so they become more supported. So you also want to look at things that you might be doing that may be aggravating that effect too. Sometimes those lines can also be called like smoker's lines because you're puckering to kind of take a smoke, and essentially that might be something that you also have to look at lifestyle changes as well too. But essentially acupuncture local around those areas have been shown to help as well too.
So Marie,
there's no exercise I can do to prevent this.
Not really. I'm assuming that you may have tried some, but you're going to have to. The only exercise that's going to work is to be able to pull your face back like a hard smile to tone those muscles.
Yes,
but we'd have to find out specifically which muscles are involved.
Yes, sir. Thank you so much. We enjoy you every Sunday.
Marie, thank you very much. Thank you for calling. We're here at 888-6. Yeah, that's what we are. 630-WMAL. 888-630-9625. She wasn't off topic. She was right on topic.
Oh, absolutely. And it's really interesting because the acupuncture points that are right on either side of the face are the stomach points. So essentially it's kind of funny. I've actually used those points a lot when people have spastic colon because you're treating one end of the digestive system for the other end of the digestive system.
That's right. The mouth is the beginning of the tube and the rectal area is at the end of the tube. Mm-hmm. And we get patients who are constipated, and we treat the mouth. We stretch the mouth, we stimulate the points, we do the things to the neck, and all of a sudden the constipation goes away. But that's quite common. So with acupuncture and weight loss, let's get back on topic just a little bit more. And, the fascinating thing is that it works. And, so much is of things we don't understand. I tell patients, well, it's like this. Can you measure it? Yeah, you can measure it. We go back to Roto-Raku points years ago, so we know we can measure acupuncture flow. We can measure hormone levels by doing lab work. We can measure nerve root pressure by doing other types of things that are available to us. So it's easy to find out where metabolism is not working. But the beauty of acupuncture is that often all of us overlook the the primacy of what the energy does in the body. And when it shuts down systems like the hypothalamus and it shuts down the pituitary and it dampens the adrenal glands, so our cortisol levels go up, we got a problem. But in this type of situation, acupuncture controls it.
Absolutely, because essentially what's happening is in the body is one cell's talking to the next cell. And so if the body thinks it's going into starvation mode or you're gaining weight, essentially it's going to have a feedback loop system. So if it is responding to something, the body knows, okay, I've had a response, I know how to shut down, I can stop this one hormone. With the way acupuncture does it is, again, it's going back to maintain that homeostasis, the balance. So it's looking for different points where things are overactive and not and underactive. And if weight tends to be what's happening and there's an accumulation of, say, fat, or we're not digesting properly, or we're not getting the nutrients we need out of there because the intestines can't absorb what we need to basically function, we can turn on and off those points and use them to help the overall function of the body as well.
So if people are really serious, they're going to combine acupuncture with diet, with exercise, and also try to get their brains under control. But that's a topic, as they say, for a different discussion.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. Give us a call. Let's see if we can put you in a little different place, something that might actually make a difference in your life. That's why we're here. That's why we do this program every week. My guest in studio, Dr. Stephanie Pina, who will be your host this Wednesday, August the 10th, 7:30 p.m., and she's going to be talking about acupuncture and weight loss and how you may have done all kinds of things and had limited results, but because your energetic pathways in your body aren't working, that nothing really lasts long term. Well, here's the truth of the matter. There's many studies. We quoted one, goes back a few years, in 2003, I think, and the results are simply this, that with acupuncture, the people who were part of that study lost 3 times as much weight as those who didn't receive acupuncture. So there's significance here. And if you'd like to find out how it relates to you, make sure you give us a call. Thermography Centers of Fairfax, ongoing sponsor. Thermography Centers, Inc. is a sponsor of Dr. Tom Roselle Live. And if you'd like to find out more about Thermography Centers, go to thermographycenters.com. And also give Dareth Painter a call at 703-943-7248, 703-943-7248. Dareth Painter, and she'll give you all the data, all the information that you need to know on thermographic imaging, one of the most powerful tools that we have available and that we use quite readily in our office. Dr. Pina, let's get back to the topic just a little bit and why and so forth. So, in your opinion, you've been at acupuncture for a long time and you've seen the results, and we're talking about a very specific application, one that has to do with increasing the body's metabolic pathway, increasing different chemistries and hormones. How does it happen?
Well, essentially, as soon as you put a needle in, you're making some kind of change in the body's going to see that there's something different. And so at first it's going to improve circulation to that area. But essentially, if you use it to a point that's going to affect an organ system, that organ system's waiting for a chemical being released from the brain. And what's happening is we can use certain points that increase serotonin, basically also help out with the vagal nerve, which goes directly to the stomach, that can delay stomach motion and basically make you have a feeling of being full more often.
How would a patient, somebody that's listening to our program today and wants to lose the weight, wants to lose that 10 pounds that they've never really been able to get off no matter what they do, it's cortisol weight, somebody who just can't stick to it and they always fail in their weight loss, why would acupuncture make the difference? Why would that be the turning point for them? How would that affect that end product, that goal that they've been so hard and so steadfast to try to apply themselves, but with no result? How does it work?
Well, with acupuncture, especially with those patients, is what's happening is whether they've been focused on diet and counting calories or not eating certain foods or, making sure they're exercising all the time and it's not essentially addressing the issues they want, you really have to look at the other things like the emotional aspect of it. If you can reduce stress overall in the body too, which acupuncture has done a great job with, help them improve their sleep as well. Essentially what it's going to do is allow the body a chance to rebalance itself, and essentially by turning on and off those neuromechanisms, you're going to be able to help in a different way that you've not been able to address before.
So here's the question. Are there any side effects? We know that there's appetite suppressions that come in the form of drugs, and medical intervention approach is not the best, and ending up for some people with bariatric surgery and cutting and tying off the stomach and the food tube. Is there any side effect? Is there anything that people have to be aware of when it comes to implementing this procedure in their weight loss program?
There's no side effects. The only thing that I tell people is it's going to be as effective as they are in using some of the things that we send them home with, and also telling us what's working for them and not working for them. Essentially, like I said, if you're eating every single day, you need to be in charge of what you're doing every single day. So incorporating acupuncture as part of a whole plan, which includes exercise, looking if there's any other metabolic conditions going on, is going to be key to the program.
So it really is much better, like anything else, when it's not a standalone situation.
Absolutely. And if you think of some of the other medications that have been on the market, especially the recent ones on weight loss where, they're appetite suppressants or they have caffeine, they'll essentially give you the energy to go work out more, or essentially the newest ones that are the ones that essentially delay fat absorption so that essentially it comes out in the stool. A lot of those are going to affect other functions that are going on and kind of put the body in a bad place. So acupuncture doesn't necessarily need to, suppress the appetite. It's going to change the way you think about food and the way you're actually, especially with your cravings too.
Yeah, we have a craving that says, I want this, I need this, I have to have this. And so many of our cravings, somebody craves salt or they crave carbohydrates. It's actually an organ system that is stepping up and saying, I need to have something you're not giving me, or I'm so burned out that I need something in addition to what we're doing. Salt is always adrenal function. And people who crave salt have a tendency to store water and store weight, and they're usually cortisol adrenal patients where all that weight's going around their midsection, and they're packing out. It's loose weight, it's water weight. It's not a very pleasant sight to look at for anybody, including the patient themselves. Let's go to the phones. Charles, how can we help you?
My father had some numbness in his legs and some occasional pain. He had an MRI, and it showed he had severe spinal stenosis from around L3 to L5. It's a bulging disc, and I wanted to find out if anything could be done for that.
Well, spinal stenosis comes in many forms and presentations. Stenosis means that there's a narrowing of the canal where the nerve exits from in between the two vertebrae. And it can come as a result of the disc, the shock absorber between the bones, getting smaller and thinner over time because the vertebrae are misaligned, they're out of position, so the disc can't pump anymore, so there's the degenerative changes that take place. And so when that canal gets closed, the nerve gets compressed. Now, the other way that it happens is you still have the same scenario where you have injury or spinal misalignment. We call it a spinal subluxation. And over time, not only does the narrowing occur because the approximation of the disc, but we get these buildup of spurs or these calcifications that occur, and sometimes they go directly into the nerve root, and they continue to close. Or we can get soft tissue that will do it. Or we have loss of the curvature of the normal spine. So there are many things. So the short answer to answer your question is simply this. Yes, there's a lot that can be done, but it depends on the severity of it, the progression that it's taken over time, and the outcome. For example, I have significant spinal stenosis in my lower portion of my neck. And that's taken place because of some very significant injuries and football and wrestling and all those things. And I've received chiropractic care my entire professional career. If it wasn't for that, and wasn't for acupuncture, and wasn't for the things that we do dietarily, I would be in a really bad place. But fortunately, because of that, I can function, I can move, I can do pretty much anything that I want to do, and I'm not in pain. I don't have any numbness. I don't have those things. But if you took a look at my x-rays and you put them up there, you would say, oh my God, this guy was in trouble. And if you looked at them years ago. Matter of fact, I had a radiologist tell me one time, do whatever you can possibly can to avoid surgery. You don't want to have surgery. The risk levels are tremendous. Acupuncture, Charles, in this situation can be huge, and it works. And I can tell you that from personal experience. It's something that I combine with manual therapies. And the end product can be extremely promising. But you have to change the chemistry of the body. You have to shift the body so it's alkaline, and you have to make sure that you're following a regime, and it takes time. It's not something that's going to happen in a month. It's not going to happen in 5-6 weeks to reverse it, although you're going to get changes symptomatically, but the resolution of the problem is going to take a much longer period of time in many months to come to a balance. Does that help? Does that make sense? Charles? Hello? guess Charles left us. But anyway, I hope that information helped him. And if we can do more, please give us a call at 703-698-7117. And also, for this Wednesday evening, Dr. Stephanie Pina will be your host at our in-house continuing education program, and she's going to be speaking on acupuncture and weight loss. August the 10th, 7:30 p.m. It's a courtesy. It's the way that we give back to the community. We'd love to have you there. Just give us a call and tell us that you'd like to be there. Dr. Pina, let's continue the process here of letting people know how they can get slim and fit again and doing some of the things that they've been doing, but doing it differently and shifting things around. So we talked a little bit about it increases the energetics. So if we increase the energetics in the body, by default, we're increasing metabolism, correct?
Correct.
Okay, so what's the correlation there? How does that happen? How does increasing acupuncture energy and increasing the energetics in the cell, which increases the burn rate of calories, fill me in?
Well, essentially, anytime, when it comes to weight loss, you got to essentially burn more than you're bringing in. Whether you're bringing in food or you're looking at exercise, you always have to burn more than you're bringing in. That's what's essentially going to help lose it, the weight. But essentially, when you're improving acupuncture points and the energetics in the body, you're able to kind of focus in on the areas where you're having the most difficulty with. If it's related to cortisol and stress, it's going to balance out the cortisol effects. If it's related to emotional eating, you're going to be able to address the stress that essentially is going on that may be causing you to drive to eat more. So it certainly is one of the reasons why you have to put it as part of an overall program, but you can use acupuncture points by itself, and also that can include the ear points and also the body points as well.
Now, the one area that we haven't talked about when it comes to acupuncture with weight loss that seems to be, in my observation and clinical experience over the years, you end up with a detoxification pathway that opens up. That helps the liver cleanse, it helps the intestinal tract open up, it helps the kidney flush, and just getting the toxins out that are being stored within the fat is part of that weight loss process.
Absolutely. And what's interesting is because a lot of those toxins are stuck in that fat itself, when you start to make those changes and notice that you're actually losing weight, sometimes people can kind of feel sick and ill, and you want to be there to support them during those processes too, because essentially everything's kind of coming out as they're losing weight. So you want to support the liver's function to detox. You want to support the digestional tract and be able to make sure that they're having proper bowel movements and that things are moving out of their system instead of being reabsorbed and creating more of an issue.
Now, we know we regulate metabolism with acupuncture by stimulating the thyroid and the endocrine glands, and your body starts kicking in the way it was meant to kick in. Sometimes it's just an energetic block, as we talked about earlier, that these systems can't work. When we look at every organ system and we look at neuromuscular systems of the body, we have to appreciate that there are many different things that stimulate them. The nervous system, the nerves that come from the spine and the brain, the blood supply, the removal of waste by the lymph system. There's an electrical buffering system called the spinal fluid, and then there's the acupuncture system. So we have to look at it from a multi-venue approach and treat the patient that way, but often the missing link is dealing with acupuncture. We have to put that in because it has a profound effect in regulating metabolism, stopping the food cravings, and helping digestion, and also calming and relaxing the system. Because some of us eat out of nervousness. We just have to have something in our hand. We smoke out of nervousness, and we have all those brain chemistries going crazy all the time. But acupuncture dampens that and quiets the system and allows the body to be tranquil.
Absolutely, and that's one of the main things when people first notice when they come in for acupuncture is they feel a sense of relaxation and rest. A lot of times patients who come in very concerned about, the fact that they're going to have needles, very thin needles placed into their system, what they tend to worry about is, or when I come back into the room, they're actually falling asleep. So the body won't, if it's in pain or it can't relax, it's not going to get to that point where it can fall asleep. But you're also going to be able to work on the same thing with cravings as well, whether it's smoking or substance abuse or anything.
It's amazing. We talked about ear acupuncture to carry over and increase the benefit, the effect of body acupuncture. And some clinics, that's all they do is they just do ear acupuncture when it comes to smoking cessation or it comes to dietary habits and so forth. Why is the ear so important?
Well, the ear itself actually has 4 cranial nerves that are coming directly out of the brain that essentially goes right to the ear itself. So you have a lot of direct inpoint to the central nervous system right there. Those same nerves basically are feeding into other areas of the body. Now, the biggest one, especially that we use and we want to pay attention to in weight loss, is the vagus nerve. And the vagus nerve feeds into the digestional tract. It goes to the stomach. It helps it basically open up and move food through, or it basically can kind of shut it down. So anytime you're affecting the nervous system in such a large degree, you're going to affect a lot of different organs that are all the way, on the other end of the body, essentially.
It's amazing to me. I've been in practice a lot of years, and every time that we have a patient that succeeds by encompassing and putting together all the different pieces and their lives change so dramatically, I just say, oh my God, the body is such a beautiful thing, but we're dealing with an energetic system. We're dealing with the energy pathways that bind and hold everything together, that allow the heart and the lungs to work together, the kidney and the bladder and so forth. And it's very documentable. It's very exact. It's very specific. Let's go to the phones. Suzanne, you have a question. Let's see if I can help you with that. Suzanne.
Oh, hello.
Hi.
Sorry. Okay. I had a thermography test done in your office.
Yes, ma'am.
Right. And then I went back. You had that special for $69.
Well, thermography did. I didn't. Go ahead.
Yeah. But I was told to take that thermography results, which they mailed to me at my home, to my doctor.
Mm-hmm.
All right. But before I left your office, they told me to have a urine test, a bone resorption, an adrenal stress test, and 3 X-rays, which I couldn't understand, cervical, thoracic, and lumbar.
Okay.
Because I had a bone scan done just 6 months ago, and I took it to your office along with blood tests.
Okay.
That showed my vitamin D was at 86.
Okay. And your question?
Oh, so when I did what your office told me to do, I faxed the thermography results to my doctor, an endocrinologist, and he said that was excessive, all those tests, and I should not have those X-rays. So I'm really at a standstill. I don't know what to do.
Okay, so first of all, you have a legitimate question, and I know your doctor has your best interest at heart, but also they don't understand the interlinking mechanisms of how the system works. When we go through, we ask you a lot of questions, and we try to dig to not just the symptomatic presentation, but why things are actually happening. And to understand why things are happening, you have to go further upstream. You got to go as far as you possibly can to find out where the initial piece of the puzzle started and how it started breaking down downstream.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, and we've been here at 888-630 WMAL every Sunday at 12 noon, answering the questions that are most important to you and trying to put you on a path of no drugs, avoiding surgery, and allowing you to take control of your own health, because truly is, you are the captain of your ship, and it's up to you. It's your decision-making process, and you need to understand what's going on. Suzanne, are you still there?
Yes, of course.
Okay, so I'm going to spend about a minute, and unfortunately I don't have a lot of time, and I don't want to share your personal stuff, even because I don't have it in front of me, and I wouldn't do it anyway, but let me kind of put this together. When we evaluate somebody in the office, we want to get as much information as we possibly can. Most patients come to us because they've been everywhere. They've had all kinds of things done to them. They're on different types of medication. And medicine generally, not across the board because I know some great medical people out there, but medicine generally looks at a problem symptomatically. You have high blood pressure, take this medication. You have high cholesterol, take this medication. This is happening, let's do this. And they may run a blood fat test. It's called a lipid panel, but all they do is cholesterol, triglycerides, the good fats, the bad fats, and they don't do anything else. Where if I'm going to send you out, I'm going to ask for those things, but I'm also going to ask for things like fibrinogen, coronary C-reactive protein, apolipoproteins A and B. Those are the things that actually can determine your risk levels and how bad the system is. If I'm going to look at somebody who is got a blood pressure problem, and by being in our office, we take blood pressure in 3 different positions, sitting, laying, and standing, all the time, every patient. And that tells us something. So if we see blood pressure drop when a patient stands up, we know that we've got a possibility of an adrenal problem, the part of the fight-flight system that needs to be explored. So we're going to do a test called an adrenal stress index, which is a spit test that's going to give us cortisol levels and DHEA and insulin levels and so forth. It gives us a lot of data, can begin to describe where things are actually coming from. So the scan that you had that you brought in with you was good to determine if there was any pathology within the structural system, but it doesn't tell us about alignment. It doesn't tell us about how the nerves can be compressed in a gravitational pattern. So we may ask for a couple extra films. So it's individualistic. Some people that we're going to ask for more things of, some people we're going to ask for less things of, but it depends. And we try to be as conservative as we can, but still get the answer of why something is happening and not just treat the symptom process, because symptoms show up when everything else has been going on for a long period of time. Does that make a little bit more sense to you?
Oh, yes, of course.
Suzanne?
Well, he was concerned about getting more radiation.
I understand. And I appreciate that, because I'm the last one that is going to tell you to go get multiple films. And I try to limit it. Like, for example, normal neck series has about 7 films, and we try to limit it to 3 when we can. And so we understand that, and I appreciate that. And, I will be the last one, and my office will be the last one to get a lot of x-rays done that we don't need. But let me know when you come in the office. If I can talk to you, please grab a hold of me. I'll be more than happy to do that. Suzanne, thank you for your call. I appreciate it. Dr. Pina, let's wrap it up a little bit, and I want you to, we got about a minute or so left. Tell us what people should expect when they come and listen to you this Wednesday evening.
Well, we're going to be talking about a lot of different things as far as why people are gaining weight, different ways that they don't normally think about gaining weight, and also why acupuncture is really important as part of the program to actually lose weight as well. We're going to look at how acupuncture has been seen in studies, what's worked and what's not worked, and how the best way it is to put it into your weight loss program overall.
Fantastic. If you'd like to join Dr. Pina, if you have a problem with weight or other types of addictions, by the way, this is a similar presentation. Give our office a call at 703-698-7117. Tell my staff you'd like to attend Dr. Pina's presentation this Wednesday, August the 10th at 7:30 p.m. Love to have you as our guest. As always, these are a gift to you. It's our way of giving back to the community so we can help you help yourselves. Give us a call. Love to have you there. Want to remind you, September 17th, Ageless Health 101. This is a program that if you're serious about taking control of your health, you got to be there, right? It's our keynote event, and give us a call before the seats are almost gone. We're filling up, and we're filling up quickly. Go to rosellecare.com, or you also can call our office and register there at 703-698-7117. The purpose of Dr. Tom Roselle Live is to give you as much information as we possibly can for you to take control of your health, to understand what's really going on, and not just to be a yes monkey to anybody, whether it's me or anybody else. Question everything that is said to you. Do your own research. I'll be here next week, 12 o'clock sharp. You be here as well. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, rosellecare.com. That's rosellecare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is